So adrenaline is it's a prototype. Just let me explain it again. Adrenaline is guys, this is the prototype. Adrenaline is a prototype drug. Sites adrenaline 80% is produced by the adrenaline, while about it's a prototype drug. Sites 80% by produced by the adrenaline, post-ganglion endings 20%. The synthesis and pharmacokinetics. For clinical use, prepared synthetically and administered 0.5 ml. Its solution is available. 0.5 ml of its solution is available, like of 1:1,000 solutions, right? So mostly this is the 1:1,000 solution. They're highly diluted. And administered subcutaneously and intramuscularly, and they are metabolized by the liver by the conjugation with glucuronic acid and sulfuric acids, and oxidized by the monoamine oxidases in the form. While in excretion is excreted in the urine in the form of aniline mandelic acid metabolites. Pharmacological actions: CNS, mostly restlessness. It may cause restlessness, anxiety, headaches, and tremors. You know about tremors? It's the shivering. You can say the shaking of your hands. This is called tremors. Eye dilate people because of the alpha-1 receptor on the radial muscle fiber, and decrease the intraocular pressure due to increased drainage. That's why it's used. It can be used in the closed-angle glaucomas. Sweat glands, increase sweating. And pilorectal muscle, stimulation of alpha-1 receptors. And along with that, heart, stimulation of the beta-1 receptors. It increases the calcium transport. So calcium is a stimulus for the T-myosin filament. Increase the contractility as well as the contraction is increased. So heart rate will be increased and the contraction is also increased. So it's picked up. And the blood vessels, coronary flow increases due to increased contraction. And the blood pressure increases, adenosine release increases. These are the effects. Peripheral vessels, mostly the vasoconstriction may occur, but of the peripheral vessels, alpha-1 receptor. Increase systolic blood pressure and increase vessels of skeletal muscle relaxed. Beta-2 leads to diastolic blood pressure decrease. This is the net result is in the peripheral vessels. That is the decreased blood pressure because of both the alpha-1 vasoconstriction effect of the alpha-1, increase systolic blood pressure and increase the skeletal muscle relaxation that causes the. And it can mostly used in the closed-angle glaucoma, epistaxis, anaphylactic shock, status asthmaticus, cardiac arrest. As I mentioned, in a cardiac arrest, the drug is directly injected into the heart. It's the last attempt, especially when someone got the myocardial infarctions or the heart attacks. And with local anesthetics, as a vasoconstrictor, they can be as a vasoconstrictor. So local anesthetics can be used in combination with local anesthetics. Another two. Contraindication. Hyperthyroidism, the drug is contraindicated because the density of adrenergic receptor on what's culture is increased. So hyperthyroidism is the counter. Hypertension may lead to brain hemorrhages as the systolic blood pressure increases. So systolic blood pressure can cause the brain hemorrhages. And IHD, this is the heart diseases, may lead to angina by increasing workload. So where the toxicity, fear, anxiety, nervousness, cerebral hemorrhages, tachycardia, arrhythmias, and angina of IHD. This can be the toxicities of the adrenaline. Antidotes, when it's overdoses occur, treatment of overdose is alpha blockers, pentolamine, while that of beta blocker is the propranolol. This is the these are the antidote of the adrenalines. The alpha blockers, they will show this phentolamine. It can cause alpha activities, where the beta propranolol can stop the beta activities of this adrenaline. This is the summary of the these catecholamine. There are so many prototype drugs, so many drugs are here, but I will just mostly explain this two adrenalines, and you guys can remember these drugs. The summary of this agonist. These are the catecholamines. You can see here. While these are the non-catecholamine. Epinephrine, receptor specificity to alpha 1, alpha 2, beta 1, beta 2. And this is therapeutic uses, anaphylaxis shocks, cardiac arrest, and local anesthetic to increase, as I did explain. Non-epinephrine treatment of shocks can be treated, but mostly they use as a research purposes. This is the receptor specificity. Isoproterenol, beta 1, beta 2 is a cardiac stimulant. Isoproterenol is a cardiac stimulant, increases the contractility, heart rate, and the myocardial functions. Dopamine, dopaminergic receptor, D receptors, right, is a can causes dopamine. They have the effects on the D receptor, dopamine, D1 and D2. Alpha 1 and beta 1 also show and used in the treatment of shock, treatment of congestive heart failure, and rise blood pressures. It can be treated with the dopamines. And dobutamine is synthetic analog, beta 1 specific treatment in acute heart failure. We discussed these drugs in detail and these cardiovascular drugs. Oxymetazolines, alpha 1 is a nasal decongestant. It is because of alpha 1 receptor activity. For relief of eye redness is a nasal decongestant. Phenylephrine also used as a nasal decongestant. For the alpha 1 receptors. And treatment of paroxysmal for ventricular tachycardia. It's a kind of tachycardia. We'll discuss these in the cardiovascular drugs. Clonidine, alpha 2, treatment of hypertension. Clonidine, albuterol. These are the non-catecholamines. Right now, we are discussing the oxymetazolines, phenylephrine, etc. So these are the metaproterol, albuterolines, beta 2 agonist treatment of bronchospasm, short-acting, mostly used in the asthmatic attacks and the asthma. These are the formoterols, indectirol, salmeterol, the beta 2 treatment of bronchospasms, mostly used in the drug action on the respiratory system. We will discuss and the respiratory drugs. These drugs, isometrols and other amphetamines, alpha, beta, and CNS as a CNS stimulant, and treatment of children with these narcolepsy, and for the appetite control. Ephedrine, pseudoephedrine, alpha, beta, and CNS, rise blood pressures as a nasal decongestant, also used in ephedrine is also used in broncho syrups. And these are the properties of the catechol: rapid onset of action, brief duration, as I did explain, do not pretend to blood. As compared to the non-catecholamine, longer duration, all can be administered orally or via inhalation. Similarly, these are the summary of the beta adrenergic receptors that you can see the heart, beta 1, beta 2, automaticity increased, or other things. You can see increased automaticity, increased conduction, velocity, and the contractility. And the cholinergic receptors, opposing action cholinergic receptors, muscular smooth muscles, vasodilation, alpha-adrenergic receptors, bronchial smooth muscles, bronchodilation, cholinergic receptors, the opposing effects. These are the various effects of these drugs on the, especially on the beta receptors. Urinary bladder, ultras, beta 2 relaxation, oxytocin, show the opposite effects. Oxytocin is the potent uterine contractor, right? Oxytocins. This is used, that's why it is used in the labor reductions. Similarly, the last chapter about adrenergic antagonist, also called sympathuretics, is they mostly counteract the effects of adrenergic agonist. Also called adrenergic blockers or sympatholetics. There is a various terminology that can be used for the adrenergic antagonist and mostly bend to the adrenal receptor, but do not trigger the usual restricting mediated neurotransmitter effects. But mostly, they block the effects of adrenal receptor drugs. So these drugs can either be reversible and irreversible, attaching to the adrenal receptors, thus preventing activated by endogenous or exogenous agonists. How they are reversible and irreversible, we will explain this later on. Like the agonists, the adrenergic antagonists are classified according to their relative affinities for alpha and beta receptors in the sympathetic nervous system. That's why we have classified it according to their alpha blockers, alpha antagonists, beta antagonists, or alpha blockers and beta blockers. And numerous adrenergic antagonists have important roles in clinical medicines, primarily to treat diseases associated with the cardiovascular system, as I was saying. Mostly those diseases that are concerns with the cardiovascular systems that can be treated with these beta blockers. Like alpha blockers, mostly for pressure stopping. Beta blockers are cardiovascular disease, the contractility affects the affect the negative, positive inotropic, negative inotropic, like congestive heart failure. This is the classification. Alpha blockers, doxycycline, phenoxybenzamines, pentolamine, prazosin, tamsulosin, tirazosin, UMB. Tamsulosin for prostate cancer, prostate enlargement, prostatitis. Beta blockers, acebutolol, etinolol, carvedilol, ismolol, labetalol, metoprolol, all lol are, these are beta blockers. Propanolol, temolol, and drug effect in the neurotransmitter uptake or release, guanethidine and reserpine. Reserpine shall become reuptake of the non-epinephrine into the vesicles. They are stopped by the reserpines. While the release of non-epinephrine from the vesicles, they are inhibited by the guanethidine. Right? So it can be, they can be the antagonistic effects of the drugs. Further classification of blockers and available trends in the market, you can see from generic. The reserpine is available on generic only. And the beta blockers, you can see these drugs. This is the classification. Guys should remember this classification. Alpha adreno receptor antagonist. One is a selective, non-selective, and miscellaneous. Selective, they can be classified into alpha 1, alpha 2. Right, selective. Similarly, they can also be classified by, for example, beta 1, beta 2, and beta 3. This also can be. This is alpha adreno receptor antagonist. Remember, this is alpha receptor antagonist. So they are also non-selective, selective, and miscellaneous. Alkyl-alkalides is the miscellaneous one. Irreversible and reversible pentolamine into tolazine. Phenoxybenzamine is a reversible one. This is about the alpha adreno receptor antagonist. Alpha adrenergic blocking agents are alpha adrenergic receptors blockers. Okay, guys. So alpha adrenergic blocking agents antagonize either alpha adreno receptors, alpha 1 or alpha 2, depending on the specificity of the agent for the receptor subtypes. Either alpha 1 receptor block the alpha 2 receptor specified block, but it should be noted. Drugs that block alpha 1 profoundly affect blood pressures. The alpha blockers, mostly they're related to the blood pressures. Hypertensive drugs alpha blocker are the most prominent one that is used for the treatment of hypertension. Normal sympathetic control of the vasculature occur in large part to agonist action on alpha 1 adrenergic receptors. Blockade of these receptors reduce the sympathetic tone of blood vessels, resulting in decreased peripheral vascular resistance. As a result, blood pressure can be reduced. This lower blood pressure induces reflex tachycardia. The magnitude of the response depends on the sympathetic tone of the individual when the agent is given. Selective alpha 2 adrenergic blockers have very limited clinical utility. अल्फा 1 ज्यादा clinical efficacy से वाला या effects से वाली utility as compared to the alpha 2. Alpha 2 limited clinical utility. These are some side effects that are associated with the alpha adrenergic block agents. Orthostatic hypotension, that is because of the alpha receptor stimulation, blockation. Tachycardia, dizziness and headache, sexual dysfunctions. This is some adverse effects of observed with the alpha adrenergic block agents. We will discuss these alpha blockers and the hypertensive drugs, as well as the cardiovascular drugs and the cardiovascular drugs in very details. This is the summary of the effects of adrenergic blockers and the changes in blood pressure induced by isoproterenol, epinephrine, and norepinephrine. You can see, let's just understand this one. Alpha adrenergic blocking have no effects on action of isoproterenol, which is the pure beta agonist. Isoproterenol is the pure beta agonist. And if this is the blood pressure rises, blood pressure lower down, this one. So pre-treatment with alpha blockers is there is no effects of the alpha adrenergic blockers and this the pre-treatment with alpha blockers. Pre-treatment with beta blockers also no effects, right? As they are the isoproterenol, which is the pure beta agonist. Isoproterenol is the pure beta agonist. So they don't have any effects on the alpha receptors. Epinephrine, so it can lower down alpha adrenergic blocker, reverse the vasoconstrictive action of epinephrine. The effects of the beta effect, the beta drug is a competition, so the alpha is a competition correlation. That's why their constructive actions is on epinephrine alpha adrenergic blocking actions. Where again you can see there is no effects of the alpha adrenergic blockers on the beta blocker. Non-epinephrine is as you know, epinephrine same like this one. Treatment with alpha blockers, and they have no treatment with the beta blockers, so they can be there are no effects on the beta blockers. So treatment of the beta blockers. That's okay. That's why can I say agonist antagonist. Agonist की एक सेता सोची competition में antagonist agonist. कम receptor पर receptor का antagonist attached है. Agonist राशि के पर उसके alpha blocker दे और beta blocker का beta agonist है. Antagonist. هذا نشي لكم replace كمان نشي affinity خبره. Beta adrenergic blocking agents. All of the clinically available beta blocker are competitive antagonists. Non-selective beta blocker act at both beta 1 and beta 2 receptors. They carry selective beta antagonists primarily block beta receptors. Beta 2 receptors in the lungs as well as the beta 1 are most in the heart, so primarily block beta 1 receptor. There is no clinically useful beta 2 selective antagonist activities. Beta 2, we need a beta 2 agonistic activities. The drug also different intrinsic sympathomimetic activities, CNS effects, blockade of sympathetic receptor, vasodilation, and pharmacokinetics. These are the intrinsic sympathetic activity. All blockers lower blood pressures. They do not induce postural hypertension because the alpha adrenergic receptor remain functional. Beta blockers become orthostatic blood pressure, the postural position surgical hypotension dies. They are the beta blockers effects because is the posterior hypertension are most associated with the alpha receptors, and beta blockers have no effects, no affinity at alpha receptors. That's why do not induce. This is the side effects. Alpha blockers mostly induce posterior hypotension, or you can say position change. Whenever we change the position, the position occurs. So beta receptors do not have that kind of effect because they are most stimulated beta receptor. They do not receive posterior hypertension mostly stimulated with the alpha. That is except for blood vessels, cooling of blood vessels, alpha receptor stimulation. Beta blockers effects. Beta blockers are effective in the treatment of systemic as well as portal hypertension, angina, cardiac arrhythmia, myocardial infarction, heart failure, hyperthyroidism, glaucoma. So that's why we will discuss this beta blockers in these chapters, cardiac and the cardiovascular systems, and detail. Though they are also used, beta blocker are also used in the migraine, in the prophylaxis of migraine. As I mentioned, that names of beta blockers end with the name alol or lol, except for melibitalol and carbidopa. These are the beta blocker effects. Beta 1 here in the, so this is decreased heart rate, decreased contractility, decreased conduction. So this is the cardiovascular beneficial effects. Decreased blood pressure, heart rate increase, contractility increase, conduction increase. So they will lower down the blood pressure. Decrease the myocardial oxygen demand. They will decrease water and salt retention. Decrease oxidative and inflammatory stresses. Attenuated cardiovascular remodeling. So this is the third generation, vasodilation alpha 1 blockade, increase the nitrogen oxide variability. And this is also increase the RAS. RAS is the renin-angiotensin aldosterone systems. They play a major role in the blood pressure regulations. This is very important, the definition, estimation of the half-lives for some beta blockers. This is very important as they are mostly used to treat the hypertension, but how much nedolol, nebivolol, carbidopa, nebivolol, timolol, propranolol, metoprolol, pindolol, etc. So you guys must know the half-life. Why? Because whenever we are treating, we are used to treat hypertension. So this is very important that which kind of drug is used. Either a long, this one is like, for example, you have to keep in mind the other therapeutic purposes, the therapeutic efficacy. But they show 14 to 24 hours of the half-life, which means that you can take tablet once in a day. And these are the the effects of propranolol. Is the effects of propranolol on the beta 2 receptor bronchoconstriction. Beta 2 reflex peripheral vasoconstrictions on the blood vessels. Red force decreased. So propranolol decreased cardiac output. Blood pressure decreased. And these are also acetylbutyol, etimolol, metoprolol, nebivolol. So these are the effects of these etimolol other than the propranolol on these vessels and these major arteries. So net result is to lower down the blood pressure. So we will discuss these beta blocker, alpha blocker details and the cardiovascular system as well as in the central nervous system, drugs, external central nervous system. This is all about the sympathetic, sympathomimetic, sympathetic, and parasympathomimetic and sympathetic agents. So it's all about these chapters. So finish this. Thank you so much.